Hello, my name is Anne Forsyth. I'd like to introduce you to the 5 fundamentals of civility. In response to the 2015 staff survey results, the corporate action plan includes the theme about regaining respect. One of the ways in which we hope to regain respect is by introducing the 5 fundamentals of civility model, which was developed for the healthcare setting by Dr. Michael Kaufman from the Ontario Medical Association. The first fundamental of civility is respect others and yourself. Regardless of role, even those we barely know, disagree with or dislike. Accept and acknowledge the value of oneself and others. Be present. Pay attention. Listen. Put your phone aside. Be on time. Their time is as important as yours. Be inclusive. Value what others can bring to the table. Assume positive intent. Seek to understand. Self-respect is key. The second fundamental of civility is to be aware. If you could stand in someone else's shoes, hear what they hear, see what they see, feel what they feel, would you treat them differently? Civility is a deliberate endeavour requiring conscious awareness of oneself and others, making a choice to be aware. Mindfulness and reflective practice enhances your awareness. Other things like group supervision or reflection can also help, and good, effective feedback. Sometimes there's a gap between the intended message and how it impacts upon others. We need to be more aware of how what we say and do impacts upon others. The third fundamental of civility is to communicate effectively. It's more about how we say it as much as what we say or do. Words are powerful. They can flay like whips. When hastily chosen and self-serving, they can unnecessarily hurt and discourage. On the other hand, words that are well chosen, considerate and timely can lift spirits, motivate, heal and connect us. Listen to connect, not judge or reject. Give praise. Give helpful feedback, and receive feedback positively. This is a useful tip to remember. A for aware. Be aware and notice any change in physical or emotional state. B, breathe. Take a deep breath. C, choose to be civil. The fourth fundamental is to take good care of yourself. It's hard to be civil when personally stressed, distressed or ill. Build your own personal resilience. There are many health and well-being schemes available to staff, but it can be as simple as not skipping meals, breaks, using the stairs or parking your car further away. Seek out your community, peer support, professional friendships, networks and alliances. You are responsible for looking after yourself. The fifth fundamental of civility is to be responsible. Be responsible for ourselves. The way we treat people matters. If we reflect on what happened at Mid-Staffordshire, the bystander syndrome, basically, it was a lack of communication and speaking up that led to a culture of systemic neglect. If you permit it, you promote it, even if an area you don't have responsibility for. If you see it, say it. It's about getting back to basics, being civil, kind and caring to one another. Close the civility gap between good intentions and negative impact on others. If we think about our trust logo and strapline, quality care for you, with you. It's about working together to get the best possible outcome for you and your family as a service user as well as a member of staff. So the 5 fundamentals of civility are respect, awareness, communication, self-care and responsibility.